you're the first female Jaw Hacks chat, and it was a
Really?
vulnerable one. You know, you put your issues out
Mhm.
there, and I appreciate that.
I know that there's other people out there that are going through the same thing, and I just want to be that person that speaks out for others as well. Because like you said, it is vulnerable, and but I know that I'm not alone in this, and there's other people out there.
All right, so we're live now, and Catherine, where are you calling from?
I'm calling from Virginia, the DMV.
Nice, nice. And yeah, what's going on? What can I help you with? What did you want to talk about today?
So, so I did want to talk about the MSC expander. I see that you know a lot about that, and I've been following you for a little while. So I actually didn't have an experience with it myself, and it wasn't the best experience. So I'm just trying to reach out and just figure this out. So around November, I got it, and I didn't really know what I was getting myself into because my orthodontist wasn't really straightforward with me about what it was. So I was like, okay, whatever, I'm gonna just do it. So about a week after my suture split, and I stopped turning about a month, and it wasn't that bad. Like I did notice like some differences here, but it looked pretty good. And then as the time kept going, it just started progressing more and more, and I was like, what's going on?
Mm-hmm.
And I kept going to my orthodontist, and I was like, what are you doing to me? Like, what is happening? I'm noticing like my cheekbones are like different. This side of my face like expanded way more than the other side, and I'm sure that's pretty common with MSC. I've seen the other videos, but she just kind of made it seem like I was exaggerating and overreacting. So she was like, it's fine, everyone has, asymmetry and all of this and that. And me, of course, I was like, whatever. I didn't really take initiative into it until recently.
Mm-hmm.
So I guess my big question is, and I am in this Reddit, so a lot of people are wondering as well, is there anything that can be done to kind of reduce the expansion of it and kind of like bring my lower jaw back? I mean, my upper jaw. Is there anything?
Yeah, so what I'm hearing from you is you had MSE and
Right,
you're pretty much unhappy with the results. Like there was an
right.
asymmetry and you're not happy with the way your face looks after. You think it caused changes to your face that you're unhappy with?
Yeah, so pretty much like my whole life, like my jaws have been very different on both sides. So this side of my jaw is more like structured, and this side has always been a bit more rounder, which is fine. So just with how this side expanded more, when I turn my head, you can like see it kind of like sticks out like that, and that
Mhm. Let's
really
see the other
bothers
side.
me.
Can we see the other side?
The other side, I think it looks pretty good because it's just like it's not a lot, you know.
Yeah.
And then the other side is like a lot. And I, well, I never used to have this, I've always had like a pretty like narrow cheekbone structure. I still have some cheekbones, but it's been narrow. So it's seeing this difference. It's just I just don't like that.
Yeah, and can I see what your smile looks like? I want to see if the asymmetry is reflected elsewhere besides just in your cheekbones.
So I did have a cant, so she put screws into my teeth, and she kind of lifted my face up like this.
Okay.
But it's
It
still, from seeing it, it's still a bit canted a little bit.
Yeah, can you smile big and get a little bit closer so we can see that nice and good? I mean, your arch is like really big and wide and looks
Yeah.
super full, like in a good way. Yeah,
Thank you.
you have a
Thank you.
beautiful Hollywood smile, and the
Thank you.
cant is not. It seems to be headed in the right direction. I don't even see a diastema or anything. Smile again. I want to see if you have a bite on that overexpanded side. Are your teeth touching over on your right side?
Uh,
It looks like
Not
it.
really. No.
They're not.
I mean, it's gotten better, I think. And I used to like bite like this, so I had
So show me the side that expanded more. Point to it.
this
It's
side
that
right
side.
here.
Yeah, your right side.
Right.
Mhm.
Mhm.
The bite seems okay. How does it feel?
Um, I think because I mean it feels fine. I think because I'm going through the process of braces, it's gonna, get a lot better
Hmm.
as time goes on. So it's not gonna be perfect right now, but it feels okay. It doesn't feel like really uncomfortable or anything.
Can I see the roof of your mouth, please? Can you just lean back and open wide?
Yeah. Can you see
Huge.
it?
Yeah, it's huge. So the MSE is out.
Yeah.
Do
Yeah.
that one more time so we can get a more sustained view,
I
please.
have a picture if you guys if I can show if that's better.
Like you're just going to put your phone up to the screen?
Yeah. I have
Sure.
so this uh, so this is my now. So this is what my palette looks like now.
Hot diggity damn, that's a wide palette.
I know. But before I even got braces, my palette was a decent. I think it was a nice. It was just more narrow than my lower jaw, so I had like this open bite. So this is my palette before I got braces.
Also
And
pretty
would you say
wide.
that right?
Tilt your
So
camera a little bit cuz yeah, leave it just like that. Don't move. Yeah. I
so this
mean,
is before, and I had yeah,
that's better
I
than,
had all my teeth
90% of the people I talk to. You're wider than 90% of the people I talk to before you even did the MSE. So,
right.
whose idea was the MSE? Did you find MSE online and then you sought out an MSE provider and were like, "Hey, I want this," or did you literally just like you ran into an MSE provider, you didn't even know what it was, they recommended it for you, and now here you are?
Right. So I had an orthodontist. She actually was like, "We're gonna widen your upper jaw," not even telling me what was gonna happen, not even telling me what the expander was, or else I wouldn't have done it if I knew any of this. So I just was like, okay. She's telling me that she had other patients. She knows how to do this, and I just went with it. I was more focused on the end result of it, and not really investing into my own research, which, but I can't go back. So yeah, I didn't. Yeah.
And what did you hope the end result would be? Like, were you just doing this to get a better bite?
I think so. I don't really know my thought process of, I think I just wanted to fix my bite. I was clenching a lot. I would wake up and I would, because my teeth were kind of like I had an open bite. So I was just clenching a lot
How
and
old are you?
I just wanted I'm 18.
Oh, very young.
Yeah. So I feel like MSC wasn't really necessary. There would have probably been other options because I am younger. What do you
Did you
think?
have any
And
problems breathing through your nose before?
honestly, I mean, I did have really bad allergies. I would get really bad. Like I would have like itching and like redness. I would have a lot of sinus problems, but I think it wasn't really bad that I wanted to fix it.
Mhm. Mhm. Interesting. So, okay, so what can I help you with? What do you hope to resolve on this call?
I want to see if there's anything that can be done to like skeletal wise to kind of fix this, just even a few millimeters,
A
because
few millimeters what in reversing the MSE expansion?
yeah, yeah, I'm willing to lose some of my expansion. I think because, like you said, it was my palette was kind of wide pretty much before. So, is there anything that can possibly be done?
I mean, honestly, not really. Like there's now that the MSE is completely out of your mouth and it's not like you can turn it backwards. All you can really count on at this point is a natural amount of relapse, which will occur. You will get some relapse, probably a couple of millimeters over the course of some time, over the course of a couple years, maybe quicker. When did you get the MSE out?
I got it out towards the beginning of April, so I had it in for quite some time.
How
Yeah,
long did you have it in?
probably like 5 months.
5 months including the expansion, or 5 months after the expansion finished?
Yeah, it was 4 months after the expansion was done.
So that's on the shorter end in terms of letting it
Yeah,
fuse up. And you're still super early in the post MSE process, which is to say, like,
yeah,
you're probably going to get some more relapse, But what specifically do you want to come back? Do you want your cheekbone to come back in? Is that the part that's really bothering you?
Yeah, it honestly, yeah.
It
And just
is.
I just want to like bring it in, you know. I used to have like a pretty symmetrical face, you know, and I feel like I just I just can't, you know, I just want to bring it in a little bit more, you know. That's is it possible to just get the expander back in and like reverse
No.
like no?
No, because think about it. Like now now you have bone there, so you
Right.
can't just compress bone, right? Like you can't just do a reverse MSE and crush the bone in, you know what I mean? Plus that would probably hurt like a biatch. I've never
Yeah.
heard of that happening. I don't think you can do that. I think like the short answer to your question is I feel like this is just kind of it now. Like there's going to be some natural relapse, but there's not going to be anything you can proactively do to reverse that MSE expansion. Barring some surgery where they literally go in and cut your maxilla narrower, but I don't think you want that. You
So
don't
that
want.
could be an option.
No, that's not really an option. No, forget I even said that. Um, because you're not even worried about your maxilla per se. You're worried about your zygoma. So what you're looking for is to like literally cut a gap into your maxilla so that you can have it kind of cave in like that and bring these cheekbones in, right? You want to
Right.
create a gap and then close it and suck these cheekbones in tighter, like that. So I don't think that's going to happen, hon. I'm sorry.
It's I think it's good that you're telling me now so that I can just start accepting it because I know a lot of I'm on like I said I'm on Reddit and a lot of people are wondering the same thing as well.
They
And
want to reverse their MSE expansion
yeah,
because they went too
yeah.
far. What are they complaining about?
I think it's the same thing that I'm asking you, like the skeletal changes. They don't like what how it's changed their face. And but they also did say that they also have like really good breathing as well, but they just everyone wants to know like how if this is possible, you know. And
Do you have any photos of what you looked like before on your
I
phone?
do.
Yeah, can you show us one of those?
So this was April of last year. This was like before my treatment. So this was I always had like my cheekbones have always been different. It's just the MSC kind of and this is my smile before. So you can see I had allergies, so but you can still see like the facial differences a little bit.
Mm-hmm.
Let me show. I'm not sure if the lighting is
No,
bad.
the lighting's fine.
Okay,
I could see that clearly. I'm sure that it's going to come out fine on the video too.
okay, because it looks brighter on my end. Um, Let me show you this one. So this is a video, but this is kind of showing how I used. It was yeah, you can see like my cheekbones were more in. It was like very. I always had like class 3 jaw, so what can you can see right?
Mm-hmm. Mm-hmm. Yeah,
Yeah,
like your cheekbones were already prominent, and your face,
right,
your upper face was already wide, and now it's just even
right,
wider. Is that the way
right.
you see it?
I mean, yeah,
Is that
yeah,
at the heart of it? Like you're like, okay, it was already wide, now it's even wider. It's too wide.
yeah,
Okay.
yeah.
What else is there for you? Is it just that? Is that like the $1 million issue for you? Is that you just want to reverse your cheekbone expansion?
Um, that as well, but I is there like other options? Like, can it be? Do you recommend like face pooling or hard mewing or anything like that to
For
kind
what?
of
To do
just to
what?
kind of bring balance? I guess just to balance the face out, pretty much.
Yeah. Um, so you're saying like, well, my mid face is wider. How can I kind of bring balance via the other parts of my face?
Yeah. Mhm.
Yeah. So just getting back to the original question about your cheekbones, like I don't really see a major issue here. I don't think that this is something you should be too worried about. Like basically what I'm saying is I think you look fine. Like
Okay.
I don't think this is a crisis where you're like, "Oh my gosh, like this is a major issue. I look really odd or something like that." Like did you see the video I did with Ryan who had the real severe asymmetry?
Yeah.
So Ryan's case is a little bit different. Like Ryan's got some issues there. Like first of all, his bite's way off. He's got that severe cant. His whole, the right side of his mouth is like lower. You can see more gum on that side. His face is way out in left field on that side, and he's got no bite. In your case, it's way more subtle, right? Like your bite is okay, your cant is okay. It's just you're a little bit uncomfortable with how much expansion you got and how wide your cheekbones really are. And
Right.
I don't think it's that big of a deal. First of all, I don't know how much there's going to be that you can do about it. So it's like, well, control what you can, change what's in your control to change, and otherwise, you can't worry about. It's not a problem if it can't be fixed, right?
Right.
But apart from that, I don't really think it's that much of a problem. Like just looking at you, I don't say, "Oh my God, why is that right side of her face way different than the left?" No, you look good.
Thank you.
You got a big, beautiful smile. Your cheekbones are prominent and wide and objectively like they look good. Um, and I just if I could send one message to you to take with you from this call, it's like just like don't worry about it. Like you're okay. You know, it's really what I'm trying to say.
Thank you. Yeah, that actually helps a lot. I guess throughout the whole process, my orthodontist was mentioning, she did mention relapse as well, um, but she did mention swelling throughout like the process. Is it possible that there could be, a lot of swelling up here and with the area that is being moved, the braces, and you know what I'm saying?
Yeah, there could be some swelling there. Sure. Yeah. You didn't have any kind of surgical assist? Obviously, it was just the MSE.
Mm-mm.
So
Yeah.
I don't want to like give you too much hope that what you're seeing is swelling or something like that, and that it's going to come down. I think it's clear that most of what you're seeing is bona fide bone-borne change, and that's if there's anything you can count on, it's a little bit of relapse. But I don't think there's a ton of swelling involved here at this point. It's not
Okay.
like you had double jaw surgery where you had tissues that were cut with
Right.
a saw. You know, um,
Yeah.
maybe like a 5 to 10% swelling factor. It's certainly not going to hurt, right? Like as you settle into it, I think it'll depuff a little bit for sure.
Okay.
Has
That's good
everything
to
else
hear.
remained constant for you?
Um, what do you mean?
Like, have there been any other changes, like weight gain or weight loss or anything like that, in your face, or is it just the MSE?
That yeah, over the past few months, um, I think I have gained a little bit of weight, which is okay, but that I know that is a possibility as well. But even before, um, I was pretty skinny before, so it was just way more, out there.
Mm-hmm.
Yeah, I didn't start noticing. Didn't really. I noticed that there's a difference in my face, sort of like January, February. Um, but I didn't really know what it was. And then March hit, and I was just going crazy on my orthodontist, and just I was crying to her so many times. And I just think it's important for people to know what they're getting themselves into. If that's like out of this whole video, I think if people should take that, they should just know that they should know what they're getting themselves into, and kind of seeing the signs when it comes to an orthodontist. And I honestly, I feel like she didn't even know what she was doing truly, and it's important. I should have done my own research, but before people make mistakes, they should definitely.
Yeah, so you're saying if you're doing an MSE treatment, be aware that there's going to be significant changes in your face, and um, yeah, that it's not this that there are consequences to doing that skeletal expander, and you should be aware of what they are. Is that what you're saying?
Right. Mhm.
Yeah. Yeah,
Because I
no,
was
for
going into
sure.
this.
I think if there's one thing that we're all realizing, especially through like my interview with Ryan and some of the comments that came on that interview, and also this chat that I'm doing with you, it's that MSE can definitely expand the face, and it's sometimes it comes out asymmetrically. Again, I just want to emphasize you and Ryan are in two totally different categories on this. Like you are not, you're okay. Like I really don't want you to have too much anxiety about this, because I'm, I think, and I'm not like accusing you of this, but like some of us, and I've done this so much, obviously, because I have such a public face when it comes to this stuff. We can become
Yeah.
fixated on imperfections in our own body, especially in our face, especially when we get into looks maxing and we start following channels like, Quove Studios and, Black Pill stuff and looks maxing. We can get really fixated on particular features of our face, and we can start to have a little bit of dysmorphia about how we actually appear to the rest of the world. I just want to let you know objectively, you are a fine looking young lady, and like your perceived asymmetry, like when I'm looking at you straight on, I can't even tell that one side is a little bit more expanded than the other. By the way, one side of my face is more expanded than the other too, right?
Yeah.
This
But
side.
you can't even tell with that one.
I mean, if we look at it, you might be able to see it. You can see it. See how much flatter this side is? And then this side is a little
Yeah.
bit more pop.
Yeah.
So the same thing happened to me to some degree. But it got better with time, to the point where you can't even notice it unless I point it out, right? So I feel you. Like I went through something similar. I think me and you are probably similar in terms of the severity of it, which is like mild as compared to someone like Ryan.
Yeah.
But it gets better with time. Um, and I don't think like you should spend any more time worrying about this, especially given that there's really not much you can do about it. I appreciate you coming on and like
Yeah.
cautioning others, and that's a super important message
Yeah.
to put out there. And I
It,
really appreciate,
mhm.
like, especially you're the first woman who's been on a Jaw Hacks chat, and you're putting yourself out there and making yourself vulnerable, and you're taking this insecurity that you have and you're putting it out there for hundreds of people to see. Okay. And for the benefit of other people. And I'm really grateful for that. But like,
Yeah.
once that's done, I really want you to put this behind you and just move on. It's such a minor thing in the big scheme of things. And in terms of like aesthetic imperfection, uh, and I would say, like, I'm not even sure that you look worse after MSC. Like, your smile is, first of all, your smile is unbelievable. Smile for me.
Thank you.
Like, oh man, when those braces come off and you get like a nice white finish on those teeth,
Yeah, that's
that's
what I'm
gonna
gonna get.
pop.
Thank you.
No, that's gonna pop real nice, you know. And then remember,
Yeah.
like, and this is super well known in the community, but if you are the primary thing you can do to change what what the puffiness of your face or the roundedness of your face, just if you somehow find a way to like do a little bit of muscle work in your face, and at the same time uh, lose some fat in your face. And this is what everyone is trying to do, right? Everyone's trying to like optimize the body fat in their face to get a nice bony kind of hollowed out model look. that's still something that's in your control too. So,
Right. So I have,
um,
yeah, so I do practice mewing, and
mhm,
I've been practicing tongue posture and regular posture for the past few months. Even ever since I got in November when I got the expander, I came across mewing. So I feel like it was fake, you know?
mhm,
Like the minute I got the expander, I see this YouTube recommendation on mewing, and I was like, okay, what's this? So I've been practicing that as well.
mhm.
I also have one more question with you about that. So, and do you think posture is more important than, I guess, obviously, like keeping your tongue at the roof of your mouth, but do you think posture is probably the main thing that everyone should practice when it comes to mewing?
Posture, what do you
To
mean? Like
really,
full body posture?
yeah, just neck
100%.
posture, everything.
Yeah, 100%. But the thing about so mewing and posture are deeply interconnected, and people who get into mewing tend to fixate on posture from the neck up. But I think what you're asking, and I am definitely affirming this, is that posture from the neck down is deeply interconnected with posture from the neck up, and anyone who's doing mewing should practice all of it at the same time. Okay, so specifically, yeah, getting the posture from the neck down right is a lot easier than getting the posture from the shoulders up. So specifically, shoulders up is really hard. Shoulders from below the shoulders is a little bit easier. Okay, but when you can set the foundation of posture at the hips and in the legs and in your butt and in your arches of your feet, it actually sets a foundation for getting shoulder posture, neck posture, tongue posture right, which is super hard. And there's limits to how far you can fix your neck and tongue posture and shoulder posture, even if you don't have sufficient amount of oral volume. But yeah, it's all super interconnected. Did you have any specific questions about that?
So I guess when you mention kind of posture from the bottom, like chest down, so
Yeah.
how can someone practice that? Like what is like the main thing like we should be focusing? Like how can we start practicing that in our daily?
So that's a really good question. And when I say that posture from below the shoulders is easier, this is what I mean. Like literally, the primary thing that you have to do is you have to squeeze your butt cheeks. I'll show you what I mean.
Really?
So if you if you just so here's what a normal posture looks like, right? Like someone who's just kind of
Yeah.
lazy and like their spine sort of sways and their butt is kind of flat and their butt is jiggly because they're not squeezing it, and then they have flat feet because what happens when your butt isn't being squeezed is your legs kind of collapse in and everything is just weak and soft. But if you just squeeze your butt like this, you squeeze your butt, and what that does is it opens up your legs. So like here I'm not squeezing, right? Now I'm squeezing, and it opens up your legs. It gets your spinal position perfect, and it lifts your arches so that you don't have flat feet anymore. And then literally like you want to you want to be squeezing your butt all the time. You want to
All
be
the time.
engaging your glutes, and that's what gives you that firm lifted butt. And you should literally feel it. Like if you feel your butt when you're practicing good posture, it should be firm. It should feel like a rock.
Okay.
All right. And so you squeeze your butt, it gets your spine right, your inner legs tip out a little bit like this, your arches lift, and then that sets the foundation for here up.
So you recommend doing this when you're just standing, sitting, because obviously I don't think you can walk when you do that.
No,
So
you
just
can. Yeah, actually, when
really,
when you're walking or like when you're barefoot running, which is something I do every day, literally with every step, if you squeeze that butt cheek, like okay, so now I'm stepping on my left leg, right? Squeeze your butt cheek, and what you'll see is that um, it gets all of the muscles from your feet all the way up to engage in the perfect way, and it gives you a spring. You actually like you spring forward to the next step. And when you're running, this is super important because literally when you're barefoot running, if you just focus on your butt cheeks, and squeezing your butt with every step, you notice that your legs start popping, like you start getting a spring, like it's like boingy, 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 boingy. With each step, just squeeze your butt cheek, and it engages the whole leg all the way down to your feet, keeps your spine right, and you start springing like a rabbit with each step.
Oh wow.
So, yeah, no, when you're moving, you can definitely practice engaging your glutes. Because your ass is the powerhouse of your whole body.
Right.
It's
Yeah.
like, seriously, it has so much power, and the more you use it, the better it starts to look too. It gets super firm and lifted, and then so a way to practice that when you're not running or whatever is just standing on one leg too. That's a super good thing you can do. Because if you stand on one leg but you're not squeezing your butt cheek, you're super wobbly and out of balance. But if you squeeze your butt cheek, you know, it gives you much more stability, and it lifts your arch, which is key. You know that you're doing it right if your arch gets lifted in your foot.
Oh wow. Thank you for telling me that, because
Yeah,
I do I do work. Sorry. Sorry. But thank you for telling me that. Like I said, because I do weightlift a lot and I do work out. And I just got a treadmill actually, so I'm actually gonna keep that in mind.
nice.
Right.
Yeah, in terms of weightlifting, you can really practice this doing things like deadlifts and kettlebell swings. Because what you're
Okay.
doing when you do those exercises, like with a kettlebell swing, you're literally just like, and you're squeezing your ass to generate the power. So
Yeah.
you want to make sure that when you're doing those thrust exercises, that you're really feeling it in your glutes.
So do you recommend a lot of face, when you're face pulls to kind of strengthen the muscles up here to like be able to keep yourself up? You know what I'm saying?
Yeah, so like now we're talking about like the shoulders and stuff in the back.
Yeah.
Yeah,
Or do you
that's
just
that's
say,
way
or
harder.
okay, so anyone should just solely focus on, engaging your glutes and putting all that focus on there, and it's like a domino effect. Like everything else is gonna follow.
No, no. What I'm really saying is you have to do everything all at the same time, but that the getting your lower half right with posture is just easier because all you really have to do is squeeze your glutes and it fixes everything if you can just get good enough at it. But with the upper half of your body, it's way more the muscles are way more subtle and smaller, especially your back muscles and your lats and the muscles around your shoulder blades,
Right.
those are the ones you need to engage to fix your upper body posture, and that's way harder. Yeah,
Yeah.
that's way
Yeah. So
harder, but
people, we are focusing on a lot of the wrong things when it should always be the foundation. You know.
for sure, for sure. So like Andy Galpin, who's a famous exercise scientist, did a podcast with Andrew Huberman a couple weeks ago, and he said that it took him. He was doing pull-ups and rows wrong for 10 years before he finally figured out how to engage his back muscles instead of just using his biceps to compensate for weak back muscles when doing those exercises. 10 years he was using the wrong
Yeah.
muscles. That's how hard it is to engage your back muscles properly. You really have to focus on it, and you have to make sure that your mind is in the muscle and that those back muscles and your lats and stuff are being recruited when you do upper body exercises to make sure that they're getting stronger and that you're not just overcompensating with your biceps on things like rows like this or pull-ups, right? So with those, you want to really make sure that your shoulder blades are being tucked and that you're engaging your lats. So you want to you want to make believe like you have wings here, right? Like your lats are like wings, and you want to actually feel them and make sure they're being engaged when you do pull-ups. And one thing you can do to make sure that happens is engage them first and then do the pull-up. So instead of just doing the pull-up, feel your lats and your rhomboids and your other back muscles, get them recruited into the exercise, then do the pull-up.
Oh wow.
Yeah,
Okay.
it's really hard, but that's the way you
Yeah.
fix posture.
It's a lot of like not realizing it's like so complex, like you said, and it's a lot of like the little things that
For
people
sure.
really need to focus on. Yeah.
Yeah, it requires a lot of mindfulness. And then a lot of people
Mhm.
who view this channel, it's even harder because when you have poor facial structure, it actually causes you throughout your life to not use those muscles, because when you have poor facial structure, it screws up your neck posture and it causes you to have head forward posture like this, and then your shoulders naturally roll, and then
So I'm
all of
curious.
these all of these muscles get weaker, and then when you figure that out by the time you're 20 or 30, it's like, fuck man, those muscles are totally atrophied, and you got to really build them up from scratch.
So I'm curious. How can our structure like support everything pretty much? Like, what are the things about it that?
So like, how can you're specifically talking facial structure?
Right. Yeah.
Yeah, so the key with facial structure is to just make sure that you have sufficient ability to breathe through your nose, and then sufficient tongue space. I mean, those are the key, because if you can't breathe through your nose because your maxilla is too narrow, or your nasal passages are too blocked because it's all the bone is just so tight, then you're going to become a mouth breather, especially during exercise where your need for wind is even more. And then your tongue posture is just going to be shit because you're mouth breathing. But even if you can breathe through your nose, but you don't have enough space in your mouth to bring your tongue up and forward, that's going to cause you to tilt your neck forward so that you can open your airway. Because if your mouth is
Just
too small,
naturally.
yeah, just naturally. So
Okay.
yeah, this is key. So when humans can't breathe well because their airway is too small and their tongue is blocking their airway, which is basically just your throat, what we do is we go like this. Can you see how my chin is forward and my shoulders are kind of rolled?
Yeah. Yeah.
Because when you do that, it opens the airway. But if you want to be like this, sort of shoulders back, neck elongated rather than kinked, that 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 helps bring your tongue out of your throat. But if there's no space for the tongue to go forward, you just can't do this. So you need to make sure you have enough oral volume to bring your tongue forward, and most of the people watching jaw hacks just don't. And so there's a lot of posture problems with my audience, and a big part of that
Mhm.
just has to do with their facial structure. Now, you
Oh
might not
wow.
be able to relate because, like, looking at even your before photos, your your mouth was pretty wide,
Yeah.
So, um, so I don't know if you totally empathize with what I'm saying, but I don't know. What are your thoughts?
Um. I understand because I feel like now I can see I understand a lot more what you're saying now because when I got my wisdom teeth removed, that like kind of restricted a lot of my airspace because my mouth just got smaller when I removed those teeth. So um, but I do breathe a lot better. But I guess my thoughts on it, um, I don't sorry I don't know.
No, I mean you're the one who brought up posture. So do you feel like what I'm saying is addressing your questions, or is did you want to re-steer the conversation back toward like what your original question was or anything, or do you feel like I'm answering your questions?
No, yeah, you're totally answering my questions. I guess I had another one as well. So our neck, it's naturally supposed to have, or is our neck pretty much supposed to be like completely straight, or are we supposed to have like a little curve when because I feel like people are focusing so much on having that perfect straight neck when, and even with me as well, I've experienced because I feel like I don't. I when I see a slight curve in my neck, I'm like, oh wow, like what is this? You know.
Mm-hmm.
So
Mm-hmm.
naturally, are we supposed to have that?
So, according to Esther Gokhale, who is like my posture guru,
Hmm.
if you look at traditional peoples in places where they have really good facial structure and where posture is still super good, their necks are pretty much straight, right?
Really?
Um, and I'll post a link in the description of this video to a post I did on my blog showing what I mean by perfectly straight neck. That being said, a perfectly straight neck is pretty much impossible unless you have perfect facial structure, really big, robust airways. You're just not going to have a perfectly straight neck because you're not going to be able to sustain it because basically your throat is going to get blocked up by your tongue and by your lower jaw. So, for most of us, we're going to have a slight curve in our neck even after we make a huge amount of progress with this stuff.
Okay.
So, but the key is don't worry so much about the position of your neck. Worry about the rest of your posture, which is a lot more easier to fix. It's a lot easier to fix. And then once you get your glutes right, once you get your arches lifted and your butt squeezed, and once you get your shoulders down and back, you'll see that your neck at that point is going to have a lot less tension on it, and it's going to be a lot freer to kind of do whatever it wants to do. And it's at that point then you can really start nitpicking about, okay, should my neck be a little bit more elongated, or should it be a little bit more relaxed, or whatever. But when you get everything below the neck right, and assuming you have sufficient facial structure, like if you're super narrow, let's say you did an MSE, or let's say you did a double jaw surgery and your maxilla is just way bigger now, then I would say neck posture sort of comes naturally. And you'll know what right neck posture is because you'll fall into it once you fix everything else around it.
Okay. Thank you for that. Yeah. Because like I said, I'm pretty new to all of this stuff. I never really had any issues at all when it came to pretty much anything. Like I didn't really practice mewing. So I guess the good part is I'm realizing like the healthy ways and all of that if it comes out of this. So
Mm-hmm. Mm-hmm. Good deal.
yeah, because mewing is, yeah. And I feel like a lot of people, when they mew, they just focus more on aesthetic wise. And I mean, that it does play a role as well. But if you just have to shift your perspective, and it's important, this is healthy. Someone actually did tell me that even though aesthetically I don't like what has been done, I have a healthier facial structure, with the breathing and everything like that. So I guess it's important that I just have to shift that and just realize like, okay, I'm healthier now.
Yeah,
So,
I didn't really want to go there with you because I didn't want you to feel like, okay, I traded beauty for aesthetics. And that's what Ronnie's telling me, is that like what I did is okay because I traded one good thing for something bad. I didn't even want to say that to you because like I don't think that's what happened. I don't think you look bad at all. Okay. But yeah, you're right. And since you said it, you're right. The MSE um, did improve your airways. You have even more oral volume now. Your bite is fixed. You got a lot of functional benefits from the MSE. And that's a consideration for anyone doing MSE, is like there could be a trade-off. Ideally, you get both aesthetic benefits and functional benefits, but it's becoming more and more clear as we see more MSE cases that um, sometimes it's an aesthetic compromise rather than an aesthetic benefit, but the functional benefits are almost always there. And so it's a balancing act. But
right.
you're right to think that, okay, even if I feel like I don't look better, and by the way, I'm not agreeing that that's the case, but if that's what you feel, and I respect that you feel that way, you can still say, okay, but I'm a young woman, I'm 18 years old, and for some of the most critical years of my life, this next decade coming up, where you set the stage for your life and your career, and you go to college or whatever you're going to do, start working, you're going to be breathing and sleeping that much better, just because you have this magnificent arch and these big giant airways. And I would say that's the most important thing.
Okay.
Okay.
You're right. Yeah. So I actually do have to go, but I just wanted to thank you a lot for this call. And thank you for the information because I'm actually going to take this and start like shifting my perspectives and my focuses and everything like that. So,
Awesome, awesome, and I appreciate you coming on. You're the first female uh, Jaw Hacks chat, and it was a
yay.
vulnerable one. You know, you put your issues out
Mhm.
there, and I appreciate that. And
Right.
let
Because
me
I
know what
know
else
that I'm not alone. Yeah. I know that there's other people out there that are going through the same thing, and I just want to be that person that speaks out for others as well. Because like you said, it is vulnerable, and but I know that I'm not alone in this, and there's other people out there, like I said. So
for sure, for sure. Yeah, I really appreciate it, and let me know what else I can do to help. Okay.
yeah, thank you so much.